We're going to talk in this video just a little bit about pumping and storing milk and some of the main tips to remember. So first of all, you may not need to pump. So if breastfeeding is going well and you're home with your baby for a period of time, then pumping regularly is not necessary. Enjoy nursing if it's going well. When you go back to work, if you are going back to work, all you need is enough milk to get your baby fed on that first day that you're back to work. And then when you're at work, you're going to pump for the next day that you are at work. So you do not need to have a freezer stored up with milk. And sometimes actually pumping when you don't need to can actually lead to some problems. So if you are having a not problematic nursing time with your baby, just pump infrequently. If you want to have just a little bit of milk for a rainy day, then that is okay. So maybe once a day or once every other day could be an option for you to store up a little bit of milk, doing that after you've nursed. So how do you actually go about physically storing milk? So there are lots of different brands of breast milk storage bags and harder, like glass options as well. And that is fine, whatever you choose. You just don't want to use things that are not food grade containers. The other thing is you always want to leave a little bit of air on the top, a little bit of an empty space, because it will expand when you freeze it. So you don't want to pop those bags and have your milk go all over the place. Another thing is, generally speaking, most babies end up eating, when they get older, 4 to 6 ounces at a time. It's rare for babies to eat more than that, even though we do sometimes overfeed them with those bigger bottles. So just to make sure that you don't waste any milk, it's good to store them in smaller amounts. So instead of storing 8 ounces all together, or even 6 ounces together, store them maybe in 2 or 3 ounce bags, so that you can thaw just the minimal amount that you might need. So if your baby doesn't end up using it all, then you haven't already thawed more than is necessary. It doesn't take that long to thaw it. If you thaw 3 and they end up needing more, look through your stash and find a 2 ouncer and thaw that, and then feed that to your baby. Another thing is, you just want to make sure that you label with either yours or your baby's name and the date and time, just so you know in the future how long you've had it. How long can you store it? So that's a good question as well. First of all, we don't have lots of great research on this, and there's a lot of factors that go into it. Breast milk is by nature anti-infective. So there's qualities about it that are helping to prevent the bad bugs from growing in there and from bad stuff happening if you drink milk that maybe does have some bacteria growing in it. There are things that can help to prevent that from being a problem. So generally speaking, it can be stored and used for much longer than a prepared bottle of formula that doesn't have those things. But unfortunately, we don't have great data about exactly what happens with all different milk at all different temperatures over time. And we don't have great data about, let's say there is a certain amount of bacterial growth, how much is really okay versus not okay. We don't really know that either. So a lot of the guidelines are somewhat guesswork, but the general guidelines, and to go along with what the CDC recommends, fresh milk can be left on a countertop at room temperature for about 4 hours. In the refrigerator, it can be stored for 4 days. And in the freezer, it can be stored for 6 months for sure, and probably 12 months is fine as well. Now, the understanding here would be that the longer that milk does get stored, it is losing some of its qualities. And we're not going to go into all of the details there, but it does change and lose some of its qualities, its anti-infection and other properties. And so it's important to use whatever fresh milk you have first, before frozen for sure. So fresh milk will have antibodies that you made that day or the day before from the things that you and your baby have been exposed to. So they're going to help, be very directed help for your baby in terms of infection, but also it won't have lost as many properties as it is going to lose once you freeze it. So if you have fresh milk, always use that first. Sure, if you have really old milk that's about to expire and you want to use one of those here and there to make sure that you don't completely waste it, that's okay. But generally, if you're making plenty of milk for your baby in general, I would rather you waste that old milk and use fresh milk because it's going to have more benefits for your baby. All of those guidelines, by the way, are somewhat taken with a grain of salt because we say, so 4 hours on the countertop, but if it's cooler out and it was collected in very cool circumstances, then maybe it could stay out a bit longer. Same in the fridge. If it is stored well and is expressed in as sterile or clean of a way as possible, then it probably will be able to be just refrigerated for more than 4 days, for maybe 5 or 6 days as well, or even up to 8 days. So again, we don't have great data on this. So depending on your level of risk taking, then I would err on the side of what the CDC recommends. But if you look at the Academy of Breastfeeding Medicine guidelines, they do discuss how probably we can push things out a bit, but we just need a little bit more data to really know for sure. The other thing that I want to point out is you do not need to sterilize bottles. You should be cleaning bottles and pump supplies in between uses with soap and water, and then you can even just throw it all into the dishwasher once a day as well, or more times a day if you need to for your own sanity. But you do not need to be sterilizing the bottles and the equipment when you use it. So those are just some of the basics. There's a lot more that can be gone into, but just some of the basics of pumping and storing pumped milk for you. Have a wonderful, wonderful day. And if you have more questions or you need help from a lactation consultant or a breastfeeding medicine physician, if you're having any significant problems, more complex problems related to lactation, then find a breastfeeding medicine physician like me. I am in the Chicagoland area and can see people locally in person or virtually all throughout Illinois. So you can reach me through my website, intouchpediatrics.com, and you are doing an amazing job, and have a wonderful day.